I first met the Rotary Club of Monrovia some 4.5 years ago. At that time, they were working with the community, helping to overcome the problems caused by this dreadful Ebola epidemic. And to this day, they are still working, helping to clear up the aftermath. 2014 was a disastrous time for West Africa. Ebola decimated the population. There was little outside help. The international NGOs did not arrive for many months. Now, Ebola has been around since the 70s, but this outbreak was unparalleled.
The club realized that with very little help available, we had to act. Working with local NGOs and the Liberian government, we started a hands-on campaign of aid and support in July 2014 when the outbreak began.
Working with the Rotary Club of Monrovia, Marlow started raising funds, initially for immediate aid. Help for the people who had been quarantined, mattresses, bedding, food and other supplies, and help with hygiene, water buckets with chlorine outside every shop and office so that people could wash their hands to stop the risk of spread of this disease. At Marlow, we even sourced non-contact thermometers which were not available in Liberia. For months, the Rotary Club of Monrovia continued a hands-on program of aid and support. Eventually, the big NGOs arrived. So now the club could turn its attention to education, going out amongst the people in the villages, in the towns, explaining how best they could save themselves from catching this awful disease. The statistics from the World Health Organization and other international bodies showed a rapid decline in the rate of new infections in Liberia, that is compared to other countries in West Africa. I believe that the actions of the Rotary Club of Monrovia shortened the Ebola outbreak in Liberia by many, many months, saving many, many lives. But although the epidemic came to an end in the summer of 2015, the problems were not going to go away. 10,678 confirmed cases, 4,810 deaths, numerous medical staff had died. It was hard to see how the already overstretched health service could survive. Early in 2015, before the end of the epidemic, the Rotary Club of Monrovia launched the Ebola Legacy Campaign with a $200,000 global grant, a project to equip a medical oxygen plant. Medical oxygen is virtually unavailable in Liberia, and impure industrial oxygen is used, sometimes with disastrous and sometimes fatal consequences.
Hello, I am past President Monique Cooper Liverpool of the Rotary Club of Monrovia. Behind me you have our oxygen plant facility building here at the ELWA hospital in Monrovia, Liberia. We had several challenges that we had to surmount in order to be able to get this oxygen plant project off the ground. We're so pleased that we have overcome them. We are absolutely excited about our partnership with the ELWA hospital. We're looking forward to a successful project. Our oxygen plant has been manufactured. It is in transit on the water, currently being shipped to Liberia as we speak. We have technicians who are lined up to be scheduled to come and install the facility once it has arrived and been cleared through our ports. And once that's done, we will begin our process of training the local technicians here at the hospital who will be responsible for continued maintenance of the facility and the operations of it day to day.
A $100,000 medical global grant was then started to train medical students to help rebuild this fractured health service. 37 medical graduate students were enrolled. 10 graduated last August. 25 will graduate soon. So, what happened to the 2? Well, it's essential that a Rotary project must be properly mentored and monitored. We need to know our money is being used to the best advantage.
Dropping 2 students was a difficult decision, but they were not performing. We are looking for a long-term commitment and dedication to help and support Liberia's recovery. We work closely with the Mother Pattern College of Health Sciences to ensure our students perform well and can effectively impact the community while representing how Rotary does good in the world.
The need for highly trained medical staff is still an ongoing issue and will be for some time to come. We urgently need to train more students. We will be applying for a new global grant to train these students. If each club in district contributes at least £100, we will be well on the way.
On behalf of the Rotary Club of Monrovia and everyone who will benefit from our ongoing projects, we thank you for your generous support. You are helping us to be an inspiration as Rotary connects the world.
The Rotary Club of Marlow website has information and a PayPal link. Details will also be on the District 1090 website, so please donate and help make this project viable. Thank you.